Well, hello everyone. Welcome back to another episode of Research Works podcast. I'm feeling rather sprightly, but excited, got a bit of energy. Marissa, welcome back to the mic.
Thanks for having me, Dana.
It's always lovely to have you. I'm very well. I feel like we're in the middle of the year. You know, we've just celebrated the fact that we've passed a milestone, 300 episodes. Actually, it's a bit more than that. I think we're like 320 now.
Wow.
It's a lot of episodes, and we get to talk about more papers. I just get really excited about it.
It's awesome.
Are we a bit nerdy?
We are, but that's okay.
We embrace it.
You wouldn't be a physio researcher and not be nerdy. It's okay.
Okay.
It was embrace it. We can embrace it.
We used to get teased about that as kids, but now let's just embrace it as our identity and we can be excited about new research. How's your week been?
It's been good, thanks. Yeah, no, getting back into it after some leave. So, no, it's good.
You do look tanner because you went to tell people where you went to.
I went to Exmouth and Coral Bay for 2 weeks.
Tell people internationally what that means.
So it was about 12 hours north of Perth, where there's a bit more red dirt and some awesome snorkeling, which I will try and incorporate. I know it won't quite work with my icebreaker question, but just some awesome snorkeling, challenged my fears, and yeah, it was lovely.
Ah, so nice. Well, you're looking very tan and very jealous. It actually looks like, you've had a bit of a summer holiday.
It was wonderful.
It's part of winter.
It was wonderful. But now getting back into it because very excited today. These are the conversation we're going to have.
Yes. We are speaking with someone who it's going to help to start a lot of conversations, I think. And we just talked about, going to Exmouth Coral Bay, swimming. We haven't talked about swimming on the podcast yet in all these episodes.
We did the Iain Dutia one about the swimming. That was different. That was
different kind again. Yeah, this is really different. So I spotted it the other day on LinkedIn and pretty excited about this. Karen Graham, welcome to the podcast. How are you?
I'm well, thank you. How are you? Thanks so much for having me.
Good. It's really nice to have you. I saw that you posted this on LinkedIn. I thought, actually, yes, we need to talk about this. The title of your you have a few papers. Actually, I think I saw the systematic review one come out. I got pretty excited about that and then delved in a little bit deeper and then saw that you've actually got another paper. So we're going to incorporate maybe all concepts into one. The title of this one is Swimming for Children with Disability. Excellent title already. And it keeps going. Experiences of Rehabilitation and Swimming Professionals in Australia. And this was published in International Journal of Environmental Research and Public Health in 2025. That part is a mouthful. But in terms of the actual work, the title, it brings up so many great conversation pieces. Congratulations on these publications, Karen.
Thank you. I'm while I've been a physio for a while, I'm a baby researcher, so it was exciting to have my first 2 publications out within a year. That's really cool.
To see your name on there. You're a writer now. You've published.
Yeah.
It was such a great article to read and so many good things to percolate and discuss today based on that. Things we often think about, but then actually just I don't know how you actually change things being implemented moving forward, but I feel like your article is the catalyst for this. And you we'll go into that today. Before I delve further, I want to introduce you to our listeners. So Karen Graham is a physiotherapist with nearly 2 decades of clinical experience supporting children with disability and their families across community, school and aquatic settings. Based in Tasmania as a sole practitioner, she is a passionate advocate for inclusion and has extensive experience helping children participate in community sport. A University of Queensland graduate with first-class honours, Karen commenced her PhD at UQ in 2024. Her doctoral work focuses on co-designing practical solutions to improve access to swimming programs for children with disability.
That's a pretty good summary of who you are. I mean, that's pretty amazing. And how does it feel to hear, clinical experience of over 20 years? It's kind of, it's surreal,
it's not quite 20 years. It'll be 20 years in January, but I suppose that's coming up. But I feel I'm the imposter syndrome, makes me go, makes me sound so much cooler and better than I am. But no, I have been very, very lucky to work in some great settings across Tassie over my time down here.
That is so cool. And that's the longevity of being a physio. It's like finding things that you actually love and, because not many of us survive out to the 20-year mark.
No, and you find an area and you become more and more, I guess, experienced in that specific space, and which leads you to your PhD, which is exciting. Where are you speaking to us from today in Tassie?
I'm in Kellerby, Tasmania, so I'm sort of halfway between Hobart and Port Arthur on the southeast coast.
Yes, yep. Very nice.
Southeast coast, right.
Yeah. So lots more I could chat about Tassie, but we'll jump into our icebreaker question, which kind of then leads into what we're going to be speaking about today. So the icebreaker question for you, Karen, is what is your most standout memory about swimming? Can be pool or beach as a child. You can either go now or you can hand it to us.
I think you've got one.
I think I've got one. I was kind of reminded of this when I was advertising on Facebook, for co-design, for people to be part of our co-design process. And my mum's cousin was my swimming coach when I was growing up, and when I was in high school. And he reminded me about how much I used to balk at lactate sets. And he's like, I'd see them write the set up on the board, and I knew that it was the one that was going to make me feel like I was going to vomit. And he was always super impressed because I was the only one that would start complaining about it before we started doing the set, because I'd figured out the timing of rest and things that would be the ones that would make us feel sick. I'm so glad that that's not part of swimming training so much anymore, for the people that are doing it now. But thanks.
What
I can't hear actually. Yeah. Oh, apparently I figured it out.
You're ready to be a physio.
Still swim?
Yeah. Do you still swim now?
I still swim a bit now, and my kids are both getting really into it with surf lifesaving and nippers.
Oh, excellent.
So nippers, surf lifesaving stuff. So I've gotten back into it with them a bit, which has been really nice actually. Lovely. We go to the pool. I take my son to training and I do some laps while he's in there, and
perfect.
Yeah,
so good. Well done. So you were a much better swimmer. My story is not going to be as a high level swimming training. That's Dana, what is your memory?
Okay, so mine goes completely the other way. My memory or my experience from swimming starts with the fact that I think I've told people in the pod before, I was born in Canada. I lived there for the first 11, 12 years of my life, and I was born in central Canada. So there's no water, right? We learned how to ice skate as the first thing from Calgary, Alberta. So I think I did a few swimming lessons at school, but it wasn't like what we do in Australia. So by the time we moved to Australia, I went into grade 4. And by grade 4, most kids have been swimming for a long time, and I arrived in summertime. So I just had to be part of all the swimming carnivals, never been part of one before. And so we're in this pool. I can't swim. I've never learnt to swim because it just wasn't a priority. And then they had all these activities where you had to, it wasn't like a swimming competition yet. You had to do these activities where you had to swim under people's legs. You got to dive and you've got to do these, I don't know what they were. It's like leaderball, but you're the person that goes in between it, right? I couldn't dive. I didn't know how to get underwater because I didn't know how to hold my breath and come in under, right? Didn't know how to do that. So what did the people do? People were pushing me underwater so I go between each person's leg. I was so traumatized from that. It was terrible. Promptly, obviously, I caught up on my swimming lessons and I got to a level where I could definitely survive. I could probably swim a few laps. I might die at the end of it, but I can. And then I was just shocked by the fact that when I became a physio, we had to do the bronze medallion. Back then, I don't know why physios had to do the bronze medallion, but I had to do that in order to get into my second year of physio. So then you've got me having to do bronze medallion, but now they've changed it. If you need to do
aquatic rescue.
Yes, you just need to be able to you need to do a few dives, a few spinal rolls, that kind of thing. But it wasn't the bronze medallion. So
the more relevant stuff that might actually happen in a hydrotherapy pool.
Right. Yeah. I'm not going to swim out to sea to save someone because there'll be other ways that you'll be able to do that. And that's not where I'm doing my therapy. Anyway, a little bit scarred.
I was going to say, how do you feel? You still would hop in a pool?
I still hop into the pool and I do get quite nervous in open water because when I was younger, I watched Jaws way too early in my life. And so every time a bit of seaweed touches my leg, I'm like, oh my gosh, it's Jaws. It's going to drag me down. Anyway. So there's a little bit of trauma there when it comes to swimming, but I recognise it's a very important part of our culture here in Australia.
I think that's the thing. So it's interesting hearing that you obviously didn't come to Australia to attend, but for us here, I grew up in Perth as well. And we pretty much are at the beach or the pool from such a young age. We're fortunate to have a pool at home growing up.
Yep.
And and it's so hot.
Yeah.
We're in the pool or water a lot.
Yeah.
So my memory is, I was trying to think, but we did swimming lessons a lot as in primary school, because obviously we had a pool at home and we used to go every week. And my friend and I, we would just have so much fun. We'd go after school together to this local pool and we would swim, do our lesson, but then we would swim. Our parents were really generous to let us swim for like hours after. We would be so wrinkled. We would nearly not be able to see because the chlorine level was so high because we didn't wear goggles all the time like kids do these days, very wide. And I would leave, I'd be able to see this like ring of rainbow light from the chlorine in my eyes. And then we would always get hot chips.
Hot
chips.
Yeah.
So now I associate swimming lessons with hot chips. Yeah. And I took my daughter last night to the pool at 7:00 and the cafe was shut. Oh, no. So no hot chips. But I do have very fond memories of swimming lessons, but realising as well that it's a unique thing to us here in Australia that we are so, it's such a common thing for us to learn or be around, and that's why it's so pertinent to the children we work with.
Oh, I love that question. That was a good one. Hot chippies.
Marissa, that was like just giving you a sneak peek into the survey that we're writing up at the moment, not the one we're talking about today, but for the people with lived experience of disability and their memories of swimming and stuff.
Oh, yes.
It's interesting to hear how many times like the cafeteria at the swimming pools come up as something that's really important.
Motivation.
And makes people feel part of it. I think, it's like it's being part of a community. Yeah.
Yep. I love that.
Yes.
100%. And it's something about a reward. I feel like when you hop in the pool, sometimes even it just takes a lap or two, and I feel like I've really, so it's like the getting wet, the getting out, and then I'm going to have something.
Yeah.
You're hungry. Absolutely.
You're hungry. Yeah.
Yep.
Oh, so many memories. Thank you for taking me back all those many years. Look, it was traumatizing for me, but I got there, and so you can overcome, but hot chips is part of it. Thank you. Well, let's get into this. Let me give everyone a bit of a summary about what we're about to talk about. And it's not about hot chips, but I'm sure we can weave that in again. Swimming in Australia is one of the most popular sport for children and a common goal for kids with disability. Yet many face barriers to real participation. So in this study, the researchers surveyed 146 swimming teachers and rehabilitation professionals. And they found strong confidence in supporting swimming goals, but major gaps in knowledge of para-swimming pathways, limited accessible facilities, affordability issues, and a shortage of accommodating programs, especially outside of our cities. Their findings map clear environmental and individual factors that must change if we want every child to build water confidence, safety skills, and lasting enjoyment in the water. Everything about that resonates with me right now.
Such a good topic.
Yep.
So we've got a lot to speak to you about, Karen, but let's start with talking about swimming and what made you choose this as an area to investigate.
I am a big fan of children with disability being able to participate in whatever activity they want to do, really. But swimming, as you've already mentioned, is the most popular sport in Australia, and children with disability want to participate in it as well. There are some pretty unique barriers to swimming participation, and we thought it was pretty important to explore these. Yeah.
Wonderful. And like you said, and go into it more, and then that's how you can advocate for change, can't you, with those barriers?
Yeah.
And I think even though we might often think of some of these barriers, to formally put it together and by surveying, which we'll go into as well, it gives us this concrete, okay, this is some action steps we could take to actually help children with disability be able to access swimming more freely and easily. And like we said, growing up in Australia, we're surrounded by water. We have swimming pools. We often live in hot climates. I think it's something we not necessarily take for granted, but if we have easily accessible to it, it's something a lot of children and families enjoy. And for children with a disability, you don't want them to, A, miss out on these experiences, B, as well with their family, miss out on these unique experiences, but also as a safety skill as well to learn about water safety.
Yeah. No, we are super lucky to live on this beautiful island with amazing blue spaces. But yeah, learning to be safe in those spaces is so important for everybody, but especially for children with disability, many of whom are at increased risk of drowning, and it can take them longer to develop those skills to be water safe. So having the opportunity to participate in swimming and water safety programs is a massive priority for them and their families.
And we have to really make sure on that point that we don't leave our kids behind. I mean, I grew up in the 80s and the 90s. By the time I was here in Australia, 90s, swimming pools back then, you didn't have to have fences, for example, but now you do. And there's increasing awareness about water safety, but we've got to be thinking about our kids with disability as well, because water safety, there's a high risk, and it's so good that your work is going to be hopefully highlighting all of this. Karen, a question about when we think about swimming and children with disability, we often think about hydrotherapy. When it comes to the distinction between hydrotherapy and swimming, can you just help us to tease that out a little bit in terms of what it is we're talking about here?
Yeah, if you think about it I had a Venn diagram that I made in a presentation once. There's definitely overlap between the two.
Yes.
I love a Venn diagram, right?
Yeah.
They're both you've got physical activity, and then you've got swimming, and you've got hydrotherapy. I think it generally, there's some activities that might be part of swimming program that might also be part of a hydrotherapy program. I think it generally comes down to what the goals of the session are.
Sure.
Are they going in the water to provide them with the opportunities to improve strength and range and mobility, or where they can do supported weight-bearing activities more easily, or are they going in the water to develop swimming and water safety skills, such as those that are defined in the Royal Lifesaving Australia's National Swim and Water Safety Framework, which is what we used to classify content and assessment of intervention for our systematic review.
Sure.
And then you've got the therapy versus community activity distinction. Hydrotherapy is a therapeutic activity, and I think it would be fair to say it's more often done individually. And swimming is an activity that can be done in a community context and therefore has the additional benefits of participating in a community physical activity.
Yeah, absolutely. And I think that you summed it up beautifully there. So we know we've got hydro as a therapy tool, but we want something that the children can be able to access in the community, even with other children as well, to actually learn the task of swimming from a safety perspective as well. So I know therapists obviously providing the hydrotherapy. Now for swimming lessons, what does it take to become a swimming teacher in Australia? Is there set guidelines or training you have to follow? Does it take days or weeks or months?
There are lots of different courses and providers of education in Australia, and they're all great organisations. There is the Royal Lifesaving Australia, Ausswim, Swimming Coaches and Teachers Australia, and it's generally to initially become a swimming teacher, it's a course of a few days, but then there's a certain amount of observational or peer development that needs to occur before they get their actual qualification, if that makes sense.
Yeah.
I'm just talking of, I did mine quite a lot of years ago now. So I had to do, there was a 2-day course, I think, for the basic water training thing. And I did a infant and preschool aquatics one as well, which is another couple of days. And had to do 20 or 30 hours of buddying with other swimming teachers. And you had to go through a couple of different swimming schools. But I'm not exactly sure the precise requirements at the moment. Something that's definitely come up though is that in order to run infant and preschool aquatic sessions, you have to have an infant and preschool aquatics qualification, but you don't have to have a disability qualification to run sessions supporting children with disability. So whether that's the right thing or the wrong thing, I don't know, because, as we know, people with disability might be in your session without you knowing as well. But
But and trying to run, I think with watching my daughter's lessons even yesterday as well, and you watch this obviously you're trying to manage children and children's behaviour around water. You're trying to teach them in the early stages the safety. And then, like you said, some children, it might be, depending on the disability, whether it's more of a physical disability impacting them, that presents different issues around access. Or we've got children, there might be more behavioural sensory issues. It's a lot to unpack when we're talking about children with disabilities accessing the pool and swimming and safety. So what I want to really bring to is you had some main key research questions that you wanted to explore in this study. Can you chat to us about these main questions?
Yeah, sure. So essentially we wanted to find out what professionals were providing and what experiences they had, what was making it harder or easier to provide those programs and supports, and what they thought made it easier or harder for families to get their children to participate in swimming.
Those are such good questions. And even as you're giving the background of, what swimming teachers, what it takes to become a swimming teacher, the classes, what that could actually look like. I was just talking to a primary school teacher yesterday, and she's like, well, in your class, you can have such a range of different presentations and needs. So you do need to accommodate so much within the classroom as well and plan ahead. And then you think about swimming, of course, you're going to have the same kind of thing as well. So what excellent questions to have. Karen, when you went about answering your question, I saw that you did it through some surveys and you had a really good study design. Do you mind just walking us through what that study design looked like and what was involved in that, in answering these questions?
So we created a survey and it had a mixture of both quantitative and qualitative questions.
Beautiful.
Those questions covered general demographics, so qualification. Most of the rehabilitation professional respondents were physios, 53 out of the 55, I think.
Wow.
And
okay.
there were the 91 swimming teacher respondents or participants, whether they had specific experience or education with disability for swimming teachers, and asking the rehabilitation professionals whether they had specific swimming experience or qualifications as well, and how long they'd been working in their relevant professions. Some sort of service provision details, numbers of children they saw per week, what size groups, what diagnoses of children that they saw, etc. And asking about their knowledge and competence with supporting children with disability with their swimming goals, and knowledge of para classification. And then the qualitative questions really went into what the goals of children with disability getting in the water were generally that they saw, and really trying to nut out the facilitators and barriers to swimming participation or to service to provision for them.
Oh, fantastic. And that's a lot of respondents.
146, that's a huge amount. Was it hard to recruit?
Yeah. It didn't seem to be to start with. We did get some really great support from organisations like Swim and Royal Lifesaving Australia and Swimming Coaches and Teachers Australia distributing to their networks, as well as we are a bit health professional heavy in the research team. We have a few physios, and so the word spread. Things slowed down after a little while, as they do, and we got a lot of data in those initiatives.
Oh, that's fantastic. That's great. And then I love the title of your survey. I mean, I love a good survey that has like a good acronym. It's called SPLASH.
A good acronym.
Oh,
yeah.
Wonderful.
Yeah.
And
so
SPLASH.
Georgina is great at acronyms. I mean, thinking about her sports participation framework and those things. She's pretty good at an acronym. And we've changed the acronym slightly now. So the first survey was swimming participation linking Australian swimming and health sectors. And with the second survey and the subsequent development of this, becoming my PhD basically. SPLASH is now standing for swimming participation, linking all stakeholders.
Oh, nice.
Yeah. That subbed in very well.
Keep the acronym.
Yeah. Well done. And that's really good. And just, I guess, before we get into the results, I saw that as you overlaid all of that, it's one of my most favourite frameworks. And, another nerdy thing about us researchers, we love a good framework. It's a family of participation-related constructs. I guess just for our listeners or people who might not be aware of this particular framework as well, why did you choose this and how did you use this as part of your study?
Well, I think that a family, I nerd out on the family participation related constructs too. I really love it. Love it as a framework. And I think it's relevant to participation in any community physical activity, really. I love how it really defines the environmental or contextual factors of participation, the individual factors important for participation and the different parts of participation, because it's not just about attendance. You need to think about involvement. I love that it really nuts out those two parts of participation. In a swimming context, we kind of came up with the 5 A's for swimming being accessibility of facility and activities, acceptable professionals and programs, accommodating programs and communities, available programs and pools, pool availability, geographically dispersed population being something that we need to think about in Australia, and affordability of programs. And if you get those things right, you can support the children with disability to choose to attend. And once they're there, you're supporting their individual needs and preferences within activities. They can develop their sense of self, their confidence in the water, and something that's come out in the second survey as we're analysing it is the effect that has on their self-confidence in general as well.
Yes.
And develop their activity competence, improve their swimming skills, and that all facilitates that beautiful, meaningful involvement in swimming, hopefully. We're getting everything right.
And then it's all good, isn't it?
I love how it's like that circular thing, right? And it feeds back into the environment.
And how it all feeds into each other when we, I think about our experiences and going back to my story of my involvement in swimming. My experience of swimming was very, very challenged by my own competence. And when you look at family participation related constructs, you're like, okay, so my activity competence was quite low, but how everything was influencing me helped me to perceive that swimming was quite scary and that it made future involvement quite daunting as well. And so when you actually look at that whole framework and you put it with that lens of what our kids must have to experience as well, you can really start to think about which areas that you might want to break down a little bit more or address, because experiences for participation can be positive or negative, aren't they? And swimming can be one of those things that are very facilitatory or very prohibitive.
Absolutely. I think with the fact that we're talking about memories from when we're kids and how much they even impact us now as adults, whether they're good or bad memories. And then that will then impact how some of the children we are involved with and how whether we, encourage them to be around the pool or not and how we feel.
Right. Yeah. And so certainly our own experiences are going to influence how other people experience it too. So we've got to be very conscious of those things.
Absolutely. Yeah. So I already am getting excited to talk about some where-tos, but I know I really want to talk through your results. So can you give us a bit of a summary? What were the main highlights from your results?
For sure. I mean, it was really lovely. Well, it's not so lovely to hear about how hard it is to provide activities and things, but it was nice to hear that people said they were confident and had, good amount of knowledge around supporting children with disability with their swimming goals. But then they identified, that they don't have the resources. They don't, like swimming teachers in particular, and rehabilitation professionals also indicated that they found it hard to find swimming teachers who had the resources and skills to support kids with disability in the water to develop their swimming skills as well. Yeah.
I feel like that's a big thing that we can already implement change from already. It's just that education perspective to already swimming teachers we have, which I know we're getting there. Sorry, keep chatting through your results.
Your horses. Just getting excited.
Oh, yeah.
This is an area of big interest for Marissa, as you can all tell.
Yeah, it's all good. It's all good. Yeah, I suppose like there was interesting looking at some of the service delivery patterns with swimming teachers mostly working with small groups, and rehab professionals were more likely to have individual sessions. Rehabilitation professionals were more likely to work with children with neurological and neuromuscular disabilities.
Sure.
And swimming teachers were more likely to report working with children with amputations or congenital limb differences. And ADHD and autism were super common diagnoses seen by both groups. So, it was, very interesting looking at those patterns as well. And when we looked at them and then we analysed them, it made a lot of sense and linked to other research where kids with more complex disability required a more multidisciplinary or health professional inputted approach. Is that even that's not really an expression, is it? Health professional inputted. Sorry, I could have said that a lot better.
No, it's fine. We can make up our words. Making up words is like part. We can do things like that. We can do things like that.
Yeah, totally.
And I think looking at those different groups, it does make a lot of sense. As we're gonna develop more experience in the kind of populations that we see more often. We don't often see as physios. We don't tend to see limb difference nearly as much, and therefore we may not be as clear about the para-swimming pathway as well. It's all about kind of what you're exposed to as a clinician or as a swimming teacher. That kind of makes sense. But the question then becomes, what happens when people don't follow into those categories? What do you do and how do you support those people? And I guess that's part of the question of like, how do we make this so much more involved?
Now, so I know you've told us some of your results, but now looking at the qualitative themes, I want you to tell us, I know there were some environmental factors brought up around accessibility and availability, affordability, acceptability, lots of things that we can already perceive maybe, but it was really highlighted that these were issues. Was there anything in particular that really stood out to you, whether it was a story or when you heard like someone's feedback that just stood out to you that, this is something big and hopefully something we can change?
I think that accessibility of venues and accommodability of professionals and programs were probably the really key things that stood out to me as both things that needed to be changed and things that we potentially might be able to change. In terms of when asked about supports required for continuing their participation when they're more established swimmers, rehabilitation professionals still mentioned accessibility a lot, whereas both groups said it was something that was important when swimmers are just starting out with their swimming journey. But I guess that probably speaks a lot to what I said before, like, the rehabilitation professionals see the kids with more complex disabilities, so they're going to continue to think about those things.
Sure.
Rather than, thinking that.
So from when you completed the big things, and I think they're the big things that we've highlighted and you've summarised. Do you have any favourite quotes from either when you did the qualitative review or even with speaking with families in preparing to do this research? It
was a journey of being a clinician for a while first. Like, it was something that I saw a lot, was families struggling to not just get into swimming as a community sport, but community sport in general, and the supports that they need to be able to do that. There was also, I have, lived experience as a late diagnosed ADHD and myself, but I've got 2 neurodivergent kids, and watching them with their experiences with swimming, it was really hard to watch some things sometimes. Like the swimming teacher going, "Look at me." I'm like, he can't look at you and listen at the same time.
Right.
But I think there's a lot of quotes that have come up from the probably more the second survey is more fresh in my mind because I'm looking at that data at the moment, and just saying things like asking for what I needed. Like we talked about, did swimming teachers ask you about what you needed, what supports you needed to be able to participate? And unfortunately, several responses saying things like, this never felt like an option.
Interesting.
It was really, really hard to read some of the negative experiences people have had. But, just ask the parents. They know what their child needs. Like it's things like,
And even just your story then about, you bringing your kids. I love how both, Marissa and you are both bringing your kids to swimming lessons. And so you observe it from this lens as, as a physio, but also as a researcher, because you can't help but to see what this could be like for other experiences and things that, like you said, that example of, look at me but do all these things as well is very challenging. What other things, I'm just really curious about what you've noticed as well that probably aligns a lot with your results that you have seen within a swimming class. What else is really challenging for some of our kids with different presentations or neurodivergence? Like just give us more examples of that, because I think people in non-swimming cultures will probably, it's harder to grasp those things because it's very cultural for us.
I think something that's come out really strongly in both surveys in the results as well, but very relevant to that neurodivergent population is I knew that there would be lots of talk about physical accessibility of swimming venues. But there was so much discussion in both the surveys around sensory accessibility. Swimming pools are loud. They are echoey. They are incredibly overwhelming places to be. And some of that, well, not some of it can't be helped, but some of it is difficult to address when a lot of the sort of solutions for that, sound absorption stuff it's not very compatible with a swimming environment where it would get moldy
true.
So it's been super interesting to think about how you could troubleshoot or change that.
I mean, I have not a funny story. It's a good story in that it just so happened yesterday I was on a tour to looking at some local facilities around Healthy Strides, and I went to look at the local pool. And I met with the people there and they were saying like the pool was absolutely amazing. They talked a lot about the physical accessibility. I saw the ramps, they've got a hydro pool, they've got an accessible bathroom. And that I expected to see. And then something that I didn't expect to hear but also pleased with is they said, we actually want to make sure this is really good for from a sensory perspective because it's so loud. Exactly what you said. So we've tried to create set times where children can come in or people can come in and it's not as loud. And I just thought, wow, that is amazing. Like that does take education and support, but I imagine it doesn't happen everywhere. And then you also mentioned in this article that, while cities might have more access to this, thinking more rurally, like outside of our major cities, is a more of a challenge. Can you talk us about that a little bit more? Because I think that would be really interesting.
In terms of like making accessible facilities in rural locations.
What were the experiences? Were they, I mean, the assumption is they see less people, so maybe it's not as accommodating, but did anything surprise you or, what was found in outside city areas?
We didn't actually nut out like differences in that survey, but in terms of experiences via location, but we've just started our co-design workshops and there's been some really interesting chats about workarounds in rural areas. And it sounds like from the discussions that we've had so far that in rural locations, potentially there's just a bit more of a community mindset and people are willing to figure out a way to make it work.
So
like I was talking with a lady who lives in a rural area in one of our workshops that said that they've managed to access like school pools. And I think that's a state to state thing. I know that, the most accessible pool in the south of Tasmania is at the specialist school. And, it's got ceiling tracking that goes from the bathroom into the pool. It's amazing. But nobody outside the school can access it just because of the red tape involved. Whereas, in this rural area, school pool access, not a problem. They've like made it work so that
how good is that?
Yeah, people can use it. And it's going to vary depending on where they are, what facilities are actually there in general, and all the things. But it's nice to hear that it can happen and work.
Yeah, it's really good. And we often hear about that in a lot of research areas. We learn so much more in, say, research in developing countries, for example, and they come up with innovative solutions because there's a finite resource and they need to find a solution that everyone can work with. And sometimes thinking about that in our settings is really helpful because sometimes the solution is right there, but it does take that little bit of exploration and innovation and creativity to come together to do it together. And I love that, and that you're looking at that as well, Karen. Yeah. Really cool.
Well, you've got your national construction codes around accessibility of pools and things, but many pools and facilities were built before the current codes.
That's right,
and aren't necessarily particularly accessible. But I think it's really interesting, like there's often workarounds that can, there's something you can do to make accessibility better, I think, most of the time, right?
That's right.
It's just making sure that it doesn't have to cost the earth. Like, some things do, but
that's right.
There's always something you can do to make something a little bit better. And
I love that. That's a lovely statement. And that's like what Hercules Lecce said, which I know you guys all know Hercules Lecce with his work with Georgina Clutterbuck, one of your authors in this paper, is that whilst we want to look at the facilitators and the barriers, understand the barriers is important, but we can take a positive view and look at what are the facilitators and work with that. Otherwise, sometimes some barriers, some environmental barriers you can't change, but what is it that you can work with? And I feel like you've just summarised that so beautifully there, Karen. Yeah, it's really cool.
I really loved in your article, you had this great diagram that kind of summarised some of the key things. And, a lot of them we've talked about already. We've talked about accessibility, availability, affordability is something that I know you highlight as well, acceptability, accommodating professionals. A lot of it comes down to obviously education as well. How would you summarise in terms of, from all of this information, from your results, for us as physios, whether it's OTs or rehab specialists listening, what changes would you like to see and where to from here?
Yeah.
It's a big question, sorry.
Well, our second paper is being developed at the moment. So that's we really want to get this was the paper that was looking at the professional perspectives around their experiences supporting kids with disability in the water, and getting that lived experience perspective is super, super important.
So important.
So hopefully you can look forward to hearing out what people with lived experience of childhood onset disability had to say about their swimming experiences. And this paper that we're talking about is basically what got me to do my PhD. And I was like, well, after this, we need to get the lived experience perspective, and then everyone just needs to work together to make it better.
There we go.
But,
that's a good summary.
So we're actually currently running co-design workshops to nut out how we might actually improve those experiences. And I think it is that, it's getting the priorities of what you want to do. I want to do everything, but I obviously can't do everything within my PhD, I'm being told. So it's really, I think there's some key things that we'll hopefully be able to influence improved accessibility of venues and assist, like give teachers and venues the resources to improve experiences for children with disability that want to access their programs.
And it's just, it's so important to do this work though, right? Like, and I love how this has spurred you on to do your PhD. It takes some work to kind of look at what the what the main issue is. It's something that's important to you. And clearly this is something that's really important to you. But what are the feeders that is going to make this ultimately the best for everyone? So it's not just, a parent trying to really advocate in one part of the world, in one center to make it as good for them as possible. It's trying to make it universal and have that mentality to be able to move forward. I always think about, this is really, really random, super random, but I swear it's relevant. We were talking about swimming lessons, takes me back to the 90s when I was growing up. And back around those times, we had these things called Tamagotchis. Does anyone remember Tamagotchis? I never had one, but everyone else did. Everyone had these Tamagotchis. I was the poor kid that only got to watch the cool kids have Tamagotchis. And basically the premise of it is you had to keep this digital animal alive. Basically, you had to feed it, you had to take it for walks, make sure you gave it water and drink it. And it was one person can do a really good job, but if you had a community of people that were all reminding each other, these are the things that we can do to bring the Tamagotchi with you, do not forget it, these are the things that we can do to keep this digital animal alive, then we create this community of change.
It's true. And it's true, right? It's with everything, I think. You have to have, if you're going to make an ongoing, lasting impact. I love that you have the Tamagotchi. That just brings me to 90s and swimming lessons as well. That's brilliant. But it's about having more than one person, because only one person can do so much.
That's right.
Whether it's for the Tamagotchi
body
or
doubling,
for changes.
body doubles for people with ADHD. You need somebody else to tell you what to do, because otherwise you forget to eat or you forget to, do whatever's next.
Yeah, that's right. The Tamagotchi is part of that process. We can think about how we do that together. And I love that this conversation has really been about, an area that is really important, thinking about participation, physical activity, but what it takes for all of that to look at. And I love the 5 A's. Is it 5? There was 5, wasn't there? I think I counted 5.
Yes,
There's all 5 A's. Yeah. The 5 A's and, what we can do to make this, how to make this work well. So look, you've kind of spoken a little bit about where to from here. Big picture thinking, you've changed the world, you've done your PhD. What's that end goal that you have in mind? That you're in charge of the world, Karen. What does that look like from this perspective?
In charge of the world? Well, I don't think I think I'd be going, oh gosh, who else can be in charge of the world? No, I think it would be from a swimming perspective, it would be pretty amazing to just have these resources available for, teachers and centres to, for them to have the resources to provide better experiences for kids with disabilities so that they feel confident and able, because I am actually a big, I kind of want to, I don't know, I don't feel like inclusion is that difficult. It's I think it was summed up really nicely by one of the participants in the second in the workshop last week. This is
yes, probably
divulging too much, but ask the questions, do the things, ask people what they need and do it.
Yes.
I was like, that's like my PhD in a nutshell.
That's it.
Or in a swimming pool, a small spa, or something some other swimming relevant.
I think that's the definition of co-design, isn't it? Ask the questions.
That's it, right? Ask the questions and do the things. I mean, there's other things that we might look at. I don't know. I'm talking with one of the guys from Swimming Australia about let's make a resource of how to support people with stroke development with different disabilities. I'm like, that's a beyond my PhD kind of thing, but let's do it.
Let's do it. Yeah. And it's just starting that conversation, isn't it? It's a call to action. Who's out there? And, we can all do our part. It doesn't have to be this huge thing that you might need to do, but it might be having that conversation, and it might be just telling people a little bit about what the experience might be for someone with a disability, and these are the things that you could look at. It can be those interactions, and they're really powerful, but obviously we want to get to the policy level and make it this is just the standard thing that we do.
Yeah. And even that just in Australia, children with disabilities, it's not just about hydrotherapy, therapy and for relaxation or other benefits. But actually, you can have swimming, and you can go into a pool as a swimming lesson to learn to swim, to learn the enjoyment of water, to those things. I think if that message just starts to come across more than even that will advocate a lot of change.
Yeah.
Not belittling the reasons for hydrotherapy too. Like, I mean, I think it's basically we just need to think about what is the goal of getting the child in the water. Like, if those goals are centered around using the water as an environment to do specific strengthening, range of motion, supportive weight bearing and things, then hydro is great. And swimming and water safety skills should be incorporated into those activities if you have that skill set. Yeah. If the child and their family have goals to develop their swimming skills, whether the goal is just, and I put just in inverted commas for anybody just listening, whether the goal is just participation in a swimming program itself, or if they want to be able to do competitions, it's appropriate to support them to transition to a community swimming program, and they might even continue to participate in hydrotherapy. But they don't have to operate in isolation. Like, you can do both. It depends. It just
not all.
Depends completely.
Of all.
Yeah. That's great.
I mean, I have one more story to tell. I feel like this is bringing out all my swimming stories at the moment. So for someone who doesn't like the water very much, I've just been in my job in my early years, had to do a lot of hydro and swimming. And in my first job, I was based at a school, and the swimming teacher, they had a swimming teacher there, and it was a special needs school, and his name was Wayne and his sister Deborah, and they did like high level swimming coaching, but they also had this passion for children who had physical disabilities. And I was shocked, but I learned so much. The kids who were GMS level 4 or 5, for example, they knew how to get into the water. They'd be in the water, face down. They know how to turn themselves around. They know how to do their back float. And I remember seeing that going, he's successfully combined, even though he scared me in the early days because he made me like do all this swimming stuff. He successfully combined swimming and hydrotherapy, brought in safety skills, and he just had that mentality and thinking, and it really influenced how I saw swimming and hydrotherapy and how you can do both. But the goals were really clear, and it was always like swimming safety was always such a big thing for him. But then we had lots of code browns as well, and so I have many stories about that too. But that's for another topic. And
I think everybody that's worked in a special school has had those. Yeah,
we have a lot of those stories, don't we? But look, we can keep them to ourselves for now. I'll bring them up next time.
Yeah.
It's too traumatizing otherwise, sorry.
Do you know, when you say about hydro though, I think in the early days, I remember, to be honest, and I admit, I didn't really think about water safety so much. I thought the hydro sessions I was doing was more, maybe it was the goal set by the family. Maybe it's that I was more new to physiotherapy at that time in terms of my ways of thinking and encouraging the family for goal setting, 15 years ago or so. But it was more about, body structure and function levels and, ranging and strength and enjoyment of the water, which is still really important. But water safety wasn't something I really thought about.
And it just shows how we should be working together is the key again, like working with swimming teachers, not just doing it in isolation. Yeah. Swimming teachers working with the rehab specialists who know about the area really well. And that's how, you can break down all the barriers, can't you? Oh, gosh, we could talk about this for ages.
Developing those connections is like something. I think, again, that's a beast that I'll have to continue to work on. And keeping the Tamagotchi alive, like beyond the PhD.
That's right. Yeah, that's right.
I don't think that's one that I'll necessarily solve within my PhD, but it's something that I definitely think is super important, developing those connections between therapists and community swimming providers, community physical activity providers in general. But with swimming being
so good.
That life skill and everything as well, I think it's, really important.
Keeping it in the forefront. Gosh, we've loved this conversation. Look, we're not done yet though, because we're going to go to our final segment. Let's go into it now. Let's head into Tell It to Ed. Ed, as you know, he is our producer. He doesn't have a background in child health. I'm pretty sure he's not a swimming teacher. He doesn't have any of those backgrounds for us, but he has been listening in on this conversation and making sure that everything is recorded so everyone can hear this episode. So, Karen, in about 60 seconds or so, can I get you to summarize this work for Ed? And Ed, you'll have an opportunity for one, inverted commas, one, highlight, one question. Take it away, Karen.
Okay, so the Splash 1 survey asked swimming and rehabilitation or health professionals about their experiences supporting children with disability with their swimming goals. So what programs were available, what activities were included, what made it easier or harder to provide swimming, and what these professional groups thought made it easier or harder for children with disability and their families to attend and participate in programs. 146 participants completed the survey, 91 were swimming teachers and 55 were rehabilitation or health professionals, mostly physios. Professionals reported high levels of knowledge and confidence with supporting children with disability to swim, although in the open-ended questions, many of them reported lack of resources, lack of teacher knowledge and training or ongoing support. Further research is needed to understand the lived experience perspective or view of swimming for children with disability, and that was what the second Splash survey has done, and to create an action plan to improve swimming participation for children with disability and their families. I might try over a minute, was I?
Beautiful. Well done. Well done. Very good work, Karen. Ed, over to you for a question.
I don't have any good swimming stories to tell, so I'll just stick with my question.
Okay.
A little bit of inside baseball. There was a comment before the podcast started to insert a Tamagotchi seamlessly into the conversation, and I think the good Dr. Poole did a good job of it today. Well done.
Thank you.
Well done. And Karen, you did as well.
You did, yeah.
But that aside, I've loved this conversation.
Did we talk about it keeping a stupid animal alive? Like, I don't know. But
That's right.
and how a smartwatch is quite similar. Like,
That's right.
That's right. That's where we went.
That's how it started. Yeah.
Oh, we're back off tangent now. Well, let me bring it back.
Okay. Go ahead.
Look, I've loved the conversation today, and
Right.
I think it's been an interesting conversation from the perspective of, well, from different perspectives. And my question was going to be about that is, obviously you've surveyed both health professionals or physios and swim teachers and coaches, and I guess I wanted to get a little bit of an idea as to what might have surprised you the most about how those two groups see the same problem or the same issue, or how to get to a better solution. And I guess my end point to that would be is, I guess if someone like a swim teacher or a coach was listening to the pod today, like what's the one thing that they could really kind of change and modify, in their lessons or in their groups that would have the biggest impact?
I think from the swimming teachers that I've spoken to as well, like you already, especially if you've been a swimming teacher for a while, and even if you haven't, like give it a go. Don't automatically go, oh, I don't have experience with working with kids with disability. I can't do that.
Yeah.
Be open to it. Tell the family that you're like, I haven't done this before, but what should I do? Like, just the families are such a rich resource of information, and they will be able to tell you what their child needs or what they think the barriers to swimming might be. And you can just go from there. Something that I've heard from families a lot before, but it was reinforced in the workshops over the last week, was they're not necessarily expecting quick or any kind of immediacy with results. Like if the child gets in the pool and stays in the pool for the lesson, then they'll see that as a win in the first few sessions and go from there. But I think just be open to giving it a go.
So good.
You don't have to be perfect.
So good.
Reach out to local therapists or any sources of information that you can find, but the family knows so much
good.
already that, that's a good start.
That's fantastic. That's great advice and something so tangible right now. And it's just, learn to work together.
Thanks for highlighting a topic that I think is just the way we think about, swimming and hydrotherapy and the goals we can bring up with the families that we see. And
wonderful.
Yeah, thank you for highlighting this. I'm excited as to where to from here.
Yeah, absolutely. Congratulations on your work. I feel like we spoke to you at the right times and you just did all the workshops as well. So we got like a triple whammy. Like we've got a bit of the systematic review,
got a little bit of
splash 1, splash 2. Yeah, thank you. Well, we'll definitely make sure we keep the conversation going and speak with you as more of your papers get released. To all of our listeners, remember you can access links to papers and a lot of resources we've put online now for you on researchworks.academy. You do need to register for it, but it's completely free and you'll be able to see all of the podcast episodes listed there as well as heaps of resources. We recently put out a video on like the 2D gate app's been improved as well. Something you can use so easily with machine learning, and we've got gas templates. We've also got some video games. I think there's a new snowboarding game that you can use for your kids as well. It's kind of really cool.
It's amazing.
It's really, really good. So take a look at the website and hopefully it'll be useful for you as you all make use of all of these resources to make your practice more evidence-based. But for now, we'll say thank you once again, Karen.
Thank you so much for having me. I really enjoyed talking with you both today.
Good.
And thanks, Ed, too.
Such a pleasure. Yeah. And we'll talk to everyone again next time. Take care, everyone. Bye.
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 Physio suggested I get a smartwatch to count my steps. There's a joke because I don't have a smartwatch, so I don't have to. It's just a normal watch.
Yeah, and I don't know, every time. How's your watch going?
One of my friends says that, smartwatches and Fitbits and stuff, they're just like Tamagotchis, except the stupid animal that you're trying to keep alive is yourself. Like,
that's so good.
That's actually quite
I
clever.
love that. And only people our age will know what a Tamagotchi is because we used to have them. Oh my gosh.
My challenge to all three of you is to somehow be the first person to seamlessly integrate that into a sentence or a point of
Sure.
conversation.
Challenge accepted.